Welcome to Real Skilling, a podcast equipping HR and learning and development professionals with industry tools and news to prepare your workforce for the future. Unlock the power of your teams to reach your full potential with our skills and competency experts.
Hi, my name is Tori Matwire, and thank you for joining us today. We are now on our fourth episode in our series, You Have to Do Competencies, Now What? Today's episode will focus on competency structures, and our speakers are Catherine Kovar, Kahuna's Principal Advisor of Customer Adoption, and Bree Dance, Product Manager at Intermountain Healthcare, a partner and customer of Kahuna's. Bree, why don't you tell us a little bit about yourself?
Hey, thanks so much, Tori. Thanks for having me, Catherine. First and foremost, I'm a nurse through and through. I started at Intermountain Healthcare as a new graduate RN. And over the years, through the various opportunities I've had in patient-facing roles, I was invited to help Intermountain as they started their competency framework journey in 2010. With my participation as one of the subject matter experts along the way and shepherding the growth of this fantastic framework, I've now become the product manager of the Intermountain Healthcare Competency Framework, which, as you know, we not only are your customers, but we are also partners with you in bringing the Intermountain Competency Framework to healthcare institutions across the United States.
Awesome. Thanks, Bree. And so now I will hand it over to Catherine Kovar, Kahuna's Principal Advisor of Customer Adoption.
Thanks,
Catherine.
Tori. Thanks again, Bree, for joining us today to talk about the different structures that you've implemented. Starting off with, we had in the series that we've been talking about is how to do the competencies and the different components that you need in order to do this in-house to a company. And so this structure that we've got here is the one that I've implemented in a couple of different areas. And it was, you've got a company, you've got your values and your safety, structure for your safety competencies. And we did an engineering. So this one was for an actual company. And so then we broke it down into the different areas of connectors, wellheads, manifold, trees, and systems. And then we went into further down to locations. And what this allowed us to do is to assign the engineers the appropriate area that they needed to focus on for their competencies, but then also had the flexibility of assigning the other areas as they needed to develop in that structure. So this is just one type of designing and manufacturing structure that I've implemented. And I know that this is where I wanted to get your expertise in and how you saw your structures coming up. This next one example is also an operator structure, company B, an engineering core, and then you have reservoir facilities, production completions, and drilling, the same type of structure. And this is for field operations. But your area is a completely, unique one to me. And I thought it would be best if we, move on and talk about the different structures. And the last one the last one I had here was just the development model, the B model, which is this is a heavy operations type of structure. And this allowed us a lot of flexibility to move people and assign the things, as I said, the roles as it was pertinent to the job that they were doing out in the field. Now your structure, holy cow, this is really interesting to me. So I'm gonna let you take it over from here.
Yeah, thanks so much. I mean, you really hit several of the nails right on the head that drove our development process. And one of the first and foremost and most critical is safety in healthcare. Healthcare, energy, oil and gas, we have some very similar parallels within our verticals, and that safety is critical. When we deviate from safe practices and follow through of technique, people can get hurt. In healthcare, it's not just the operator or the caregiver that may be injured, it is also the patient on the other side receiving the care. So the first thing that drove us, that our North Star was the safety and the care delivery to our patients. But aside from that, there were really a couple of critical components. And one is that you have to understand who your audience is. And in our organization, our audience are our different caregivers, whether that's nurses, nursing assistants, respiratory therapists. You hear a lot about them in this COVID-19 pandemic. You may have pharmacists, environmental service specialists, the people that honestly keep our hospitals moving by turning over rooms and making sure that there's no infectious materials that remain between patients. How critical are they? A lot of people don't even realize how critical and highly skilled they have to be. So you have to understand the audience, and then you also need to understand the business model for why you're going through the effort to create this framework and the groupings. I mean, because if there's not a business need to do things safer, more efficient, and at a lower cost, then go ahead and keep using your checklist, right? That each individual, quote unquote, educator can have. What makes the Intermountain Healthcare competency framework different than any other vended solution on the market for healthcare? Because there's a lot of vendors that will sell you competencies for healthcare. But what makes ours different is the curated approach to our curriculums or the caregiver roles that are delivered within the Kahuna platform. Each nurse in any organization, let's just use nursing as our key word here. This could be applicable again to a number of different types of caregivers that we talked about just a second ago. It's hired into a specialty area or into a grouping called a float pool that services multiple specialties. But you're typically going to focus on an area of training initially, and then you may have career development. And it's better business for the hospital to try and organize what you need in your day-to-day role rather than training you to all of nursing skills across an entire, facility. And so we organize all of the competencies, and our library has about 6,000 different competencies, another approximate 8,000 performance-based checklists, and several thousand learning resources, and then mapping to all of the evidence-based vended content that's available on the market. And we organize them into care areas, so behavioral health, critical care, medical, surgical, oncology, etc. And what you see here are the representations of core work areas. And within each of those core work areas, even if you're a women's labor and delivery nurse, you are going to have similarities in some of your role, even to that of a behavioral health or a psychiatric nurse. You may be seeing completely different types of patients, but there are some fundamental areas to your core behaviors that align no matter where you go.
Well, just to interrupt you, that's one of those things that when you're looking at this, you have the opportunity when you're looking at each one of these areas to identify those things that are you would consider core,
Absolutely.
right? And those are the things that are transferable across, any area that you go into, correct?
Yeah, and those are when you can identify those and then, appropriately place them in your framework and then digitally deliver and assess them. That's what drives the business ROI, right? Is being able to capitalize on, my name's Bree. I was hired, hired into the float pool at Primary Children's in 2006. And if I decide to go back to the bedside next month to one of our ICUs to help take care of, our surge and COVID patients, I have applicable training that's already been assessed and is documented that they can avoid retraining me to, because they can see my initial training verification that's stored wonderfully in your digital platform, and then the ability to capture the recency of which I've been able to practice those applicable skills in the new area. And it's really been a huge savings driver in our organization to come with this curated approach, because not only does it drive the business savings for our operation channels and our orientation budget, but the other area that we found savings in, and we've actually been able to salvage and FTEs because of this is letting our educators work to the top of their skill level instead of building checklists either on their own or trying to piece together lots of skills from other vended solutions that are just basically data dumps of PDFs. You may get 2,000 different skill-based checklists from a vendor, but then you've still got to put them into meaningful use. And that really, by delivering them a standardized role that they then can customize if needed, we've just freed up the educator from really being kind of the grand poobah of paper orientation management and let him or her really get back to what we need them doing, and that's assessing the learning needs of our caregivers in our organization.
Gotcha. So, I mean, one of those things too is that when you said it, it resonated with some of the different implementations that I've done, is the fact that I can see everything about you, and then I can quickly ramp you to where I need to do.
Yes.
But I also know that we have a consistency across the area. We've all interpreted things the same way, because when you're walking into some of these different companies, they've been acting in their own way in what we call stovepipes. And what would happen is, you know, you wanted to move Sally over to a different area, and it was like, well, no, Sally can't come over here because, you know, she doesn't know anything about our business, you know, or how we do things. Whereas now you've got that consistency across the entire company. So your workforce planning is so much richer. Because now those people that typically wouldn't be maybe seen because they're so specialized in an area really can be utilized in another area, because your roles have identified that. And when you looked at your structure, so that's one thing that we start talking about when we look at the structure, is the updates and how to make your structure so it's flexible and it can grow in it. Because if you get too into the micro, right? Too much into the minutia, then it causes more difficulty. Did you struggle with some of those things when you were trying to structure it?
Yeah, absolutely. And again, this is where, so, you know, we've got some really deep parallels. And to be completely honest, I haven't become an expert in the oil and gas competency structures or what has driven, you know, your development and the specific challenges in that vertical. But what I can say in healthcare is one of the challenges and barriers for healthcare systems or educators to trust adopting another vendor solution is that they get too far into the weeds. They are not a living, breathing healthcare organization that, one, and again, most critical, delivers patient care. Two, they steward and are shepherds of the real live nurses that are having to maintain accreditation, certifications, and licensure to deliver the care. And three, go through regular accreditation and risk analysis themselves. As a healthcare organization, you know that fine balance of where too far into the weeds is, but where the evidence-based practice has to lie. And there's a very, very fine balance there that no other non-healthcare system vended offering can really provide you. And so you're absolutely right. And that really finding that delicate balance, maintaining the evidence-based core focus of our clinical practice teams, and also understanding that we don't want to put too much legal liability on a caregiver or the organization, yet ensuring safety is paramount of the patient, was a 2.5-year journey and $2.5 million for our organization to find that sweet spot. And even since that development and initial investment within ourselves, it takes us 3 full FTEs and a myriad of consultants in legal, risk, and practice to help us maintain that sweet spot so that we can provide the best structure and framework continually to our caregivers as they go out and initially train, and then, as you said, redeploy to critical areas. And we're seeing a surge in that right now, where we may not be running our operating rooms full steam ahead because our ICUs are overflowing with patients needing respiratory care related to COVID. And so we're trying to rapidly redeploy and reskill or real skill our caregivers into areas where they're most needed. And that sweet spot of not getting too far into the weeds and having just the right structure is really what enables you to do that, as you've discovered it through your years of experience leading this.
Yeah. I mean, the biggest thing that we also had challenges with is when you because we worked through a lot of the individuals, the subject matter experts, and you have a multi-prong approach because of, while the other industries have the safety and they have the certification, and those type of components, a lot of them are self-policing, whereas your industry is not a self-policing industry, right? And so
not at all.
You've got that whole other level to it. And so you have those components that had to be structured into yours versus, like I said, the other industries, they're more self-policing. And, we had to establish more not credibility, but accountability on those sides to say, you're accountable for doing this, and we're going to be accountable for assessing you and doing all these, these items.
Yeah.
So you've definitely got a different, even a higher level criteria in your system. So
yeah, and you're spot on there. I think a lot of healthcare organizations, we like to champion our caregivers to continually be self-aware and assessing where they feel like they're at. But at the end of the day, you're right. There's not a single competency that we would allow a caregiver to be practicing independently without somebody that has more experience watching over them and assessing that it was done correctly first.
Yeah, most definitely. So in the challenges, when you looked at your structure and how you were going to do it and what areas that, you determined, because I see the 3 circles, right? And I love the 3 circles because they intersect. And that's where we had, with the different groups that we helped develop their structures, it was, okay, these are the things that cut across all of you that, that are the overlap, as we call it, a lot of times the core, right? Or the foundational items. And when you built that, did you find that each one of each areas were like, no, we do it very special, and that they actually had to come to agreement on, no, this is a standard, or was that driven by your industry certification?
You've hit a hot button, my friend. Nurse educators, and maybe it's educators in every vertical.
It's everything.
Every vertical.
I went up to you because I want to know if you got the same thing I did. So
they are passionate creatures. I mean, just really passionate about where they work, the patients they're serving, and the specialty that they're employed in. And initially, everybody felt like we're pretty special. We do pretty special work. And the checklist that I've worked so hard on over the last, 5 years or my tenure here, I think it's the best. So I don't really know why we need to align here. And what really helped us, and Tori, you need to have all the credit for this lingo here, is the competency compromise is really, I think, what you've got to call it, is we had to do a thorough intake. And part of that 2.5 years and $2.5 million was the resources it took to inventory a system that at the time was about 20 facilities, and now we're just mushroomed well past that, and 40,000 employees, and again, much bigger than that now, to really go through all of our essentially IP on each unit to say, okay, what are you doing? What are the skills you're training to? What are your standards? And to really pull them together. And we had to quite frankly, we had to build a database to analyze it and get some data architects to help us evaluate it. This was no small feat. And so when hospital organizations say, I've got content, well, every hospital organization in America has a checklist or multiple checklists, and you can think that you standardized it. But until you put that microscope on a microscope on a macro level product and really invest in yourself to evaluate it, you don't really have content that can drive value. And it was tough, and it was a culture shift in our organization to go, you know what, we get to base camp. You want to climb Everest? That's great. Let's climb Everest. We got to get to base camp first. You can't run to the top without you have to get to base camp, recharge, recenter, refocus, and set the next goal. And that really, I have Tammy Richards, our AVP of clinical operations. She really deserves all the credit there, because she got us to base camp. And I won't say that there wasn't times that there were frustrations and exasperations with people feeling like they gave up what they developed. But what we've realized is you didn't give it up. You gave it to a better product. And we took the best of what everybody had done, and we aligned and evaluated that against evidence-based practice and any issue that we had run into with an accreditation visit or risk analysis or legal proceeding. And we identified the best, and we made the alignment with all of our policies and procedures as well. You can't just align your competencies.
You have to have your
policies, and your processes have to be aligned too, or you're really not standardized and aligned in your care anyways.
Right.
So we did both.
I think this whole activity, or not the activity, the whole program, when you go to do this, that's one thing, is it drives other occurrences to happen, which is, we need to have this aligned. We need to have this other area aligned. Because if you don't, then this is where you start to see, when you're trying to bring things together, that's when you see, we've got a divergence over here. And it's a lot of times what we found is it was out of our scope of what we were supposed to be doing, but we ended up having to take that on. And then people were like, great, we've been trying to do this for years, to bring that alignment between this procedure or this process and what you're doing, because you definitely have the opportunity to see how things are out of sync.
Absolutely. Absolutely. And in healthcare, the exact same thing happened, where one can't go without the other. And because educators are not always practice experts, that became muddy. And so we had to draw really clear lines in the sand to say, hey, I'm not the practice expert. So if we don't have the appropriate practice expert, we're going to have to identify and fill that need in order to really drive this ship. And well, maybe not ship if we're going to base camp, we're climbing and not on the water, but you get what I'm saying. They both were activities that had to happen. And we had that commitment to that investment in our organization. And again, that is what makes the Intermountain Kahuna offering so far different and above what you can find out there in the marketplace. Or really, it's so hard to develop. You've been there, Catherine. This is no small feat. And then to maintain it takes another investment in yourself, and it's continual. And I think that's why we're so passionate to bring this forward to healthcare systems across the country. Is we're making that investment in ourselves, and we understand what healthcare systems are up against every day, and how the profit margins, even for non-for-profit organizations, the revenue margins are so laser thin that we want to bring what we know, and we're investing in ourselves already to help other organizations be able to do the same at a lower cost. And finding that sweet spot and that partnership with you guys is really a dream come true, and helping us really reduce the cost of care delivery and improve the quality of care to our patients across the country.
Oh, I agree. And I think just also from the actual roles, the one thing that I heard loud and clear is now people and everyone can actually see everything that it takes to do what we do. And be it in the nursing industry, in the energy industry, manufacturing, it all of a sudden it really sheds a light on, yes, you have your education, but now this is how we practice. This is how we continue to develop these individuals, and really what it takes, because it's not as easy to see. It is just not, you can't see it. And that's the joy that I've taken, and obviously I work for Kahuna, is the joy that I take is that I visually can see it now. I can provide people with the capability of seeing what path they need to do and how they need to do it. And it's not just a question. It's not, well, I did it one way, you did it another way. So
absolutely.
I think from that standpoint, your structure I think this gives a whole lot of enlightenment to people to see how these things are structured and what they need to do when they're looking at this. Because I think sometimes putting it into the system, I say this is probably the easier part. It's all the upfront work and these structures and how you're going to design it. That is the heavy lifting, as I would see it.
Yeah, and very truthfully, you're exactly right. There's an incredible lift on the front end, and then there's an incredible commitment to maintenance following that. Right. And you cannot do it without substantial resources in the beginning or over the course of a long period of time, unless you want to license it from another organization or another vendor. And exactly. So throwing our own little plug for Intermountain there. But I just think it's an incredible opportunity for like-minded organizations to come together. And as Tori says, you don't really have to compromise on competency to come together with another organization and use their content. We in this COVID-19 pandemic, we've been sending nurses to New York City, and we've been receiving nurses from New York City. And we could not do that without our competency structure and essentially a digital skill passport to say, hey, look what you're getting. This is the quality of the training that we are sending with, and vice versa upon return. And that is, in a nutshell, the Intermountain Healthcare Competency Framework paired with, the Kahuna solution is really, I think it's so exciting that learning and development doesn't get a lot of, it's one of those things in any organization. It's not typically revenue generating. And so it's the first area that people go, what can you cut? I'm going to take from learning and development, or we're going to license that because I can't afford to keep these people on, and I can buy it cheaper. But it's so exciting that we're in a time in 2020 has been an accelerator for it to really come out there and make a difference in people's lives. And I'm speaking really with a healthcare focus right now, and I don't want to detract from any other verticals and their learning and development arms, but we're making a difference together, and we are improving lives, and we are making it more affordable through the structures like this for people to get care and to have confidence in the quality of the training that the person providing that care has.
Nice. Well, I appreciate you joining me today and going through your structure.
No, I've always looked up to you ever since I met you at Kahuna. So thanks for inviting me.
No, I appreciate it. I think again it goes back to is this is exactly spot on for the people to be able to understand what they need to do in the competencies and the structures. So again, thanks again for joining me. And you have a good rest of your day.
Hey, thanks, Catherine. Have a great day.
You too.
Bye-bye.
Thanks.
Thanks for joining us on this episode of Real Skilling. For more resources like this podcast, be sure to head over to our website at kahunaworkforce.com, where you'll find up-to-date white papers, case studies, blogs, and more, all about skills and competency management. Be sure to subscribe and tune in for our next episode.